Okay, well, welcome to the Cultural Competency in Youth Programming Part 2. We are going to talk about specific subpopulations. My name is Robin Donaldson. I'm the Chief Operating Officer at Indiana Youth Services Association, and we are recording this session. So thanks to everyone so much. Josh, thanks for being on and allowing us to record this as we go through this. We're going to jump right in and what I first want to do is do a review of kind of our objectives. We will talk just a little bit about general cultural competency components, kind of a review from the cultural competency part 1. Then we're going to get into looking at specific issues in working with youth who identify as gay, lesbian, bisexual, transsexual, or questioning, looking also at specific youth issues around kids who come from generational poverty. And with both of those, we'll look at best practices in serving those youth and the specific challenges that they face. So we're going to just kind of, again, just a brief overview. Cultural competency, as a definition, is basically a set of behaviors, attitudes, and policies that come together in a system of the agency, usually through policies and procedures that allow professionals and anyone working within that system to work effectively in all cultural situations. So it really is about respect. It is about meeting the individual at that specific individual level. And the ultimate goal is to eliminate disparities and disproportionalities in terms of services that are available to those folks. So he says specific goals, eliminating and reducing disparities and disproportionalities. We know that youth of color tend to be disproportionately represented in the juvenile justice system and underrepresented in the mental health services. And so they actually are being treated differently. And so part of cultural competency is to recognize that often for the most part, is a part of how the system is working with the youth and not the youth themselves, so that we can reduce those disparities and make all services available to all youth, regardless of color, regardless of ethnicity or sexual orientation, so that we can be effective with all of the youth that we work with. So those are kind of those goals around cultural competency. And there are some very direct benefits to implementing cultural competency and doing it successfully within an organization. To the youth and the children that we're working with, it actually increases and enhances their sense of self. It allows them to become comfortable with themselves and increases self-esteem. And because they also are increasing their own self-value. If other folks are valuing them, then allows them to increase their own sense of self-worth. It also increases their sense of comfort and their sense of safety. So as we treat them and meet them on an individual level, they are able to open up and they feel safer. And because they have an increased comfort level and sense of safety, we get a higher level of cooperation from them. They trust us because we are meeting them at that, we meet them, we respect them at an individual level, we value them, and that then allows them to trust us and enhances their cooperation. This mutual respect and understanding also will extend not only to the relationship that we're forming with them, but it also can broaden out to their interactions with others. It increases equality and inclusion. So because we are culturally competent, we said we are making services available to young people based upon their need and not anything else. And because of that, they are less likely to have any type of other traumatic or things that harm them. So they're less likely to feel excluded. They're less likely to have damage to self-esteem because of any type of identification with other cultural or identity issues such as race, gender, sexual orientation, those types of things. And because they're more trusting and they're more cooperative, they are less likely to get in trouble with authority figures as well. So it really does benefit the young people, which is the main reason that we are doing this. However, there are benefits to staff and to the other adults who are working with these young people. If you are part of a culture that is culturally competent, then it is more supportive and inclusive of staff as well and other adults. So you get it, the benefits don't just extend to the young people, but also to the adults in that environment. What I've noticed working in youth services is that a lot of times the activities that we're doing with the young people are only as effective as staff's buy-in and belief in what they are doing in those activities and events. And so if you have staff who feel fully supported, who are fully inclusive, um, and part of that team and believe in those events because they actually recognize the respect that we're extending to young people, then they are going to staff themselves and the adults are going to participate fuller and with more enthusiasm, which also then kind of translates to at least more enthusiasm or interest in the young people. And so, everyone benefits. Obviously, people are in this work because they want to, I say obviously, but for the most part, they want to help youth. They're there because they value youth. And this allows them then to build those better relationships that are more fulfilling for staff as well. Because the money is not great, then, a lot of times, when people say why they do what they do in this field, in youth service field, they talk about it having meaning. And if you have that better relationship, then oftentimes that's the way that that meaning is expressed in our work. Because we're respectful, because there's more cooperation and there's more trust, they get, the young people are more honest, and that allows us then to conduct better assessments. We have a better understanding of that young person. And because of that, we can build more successful and more meaningful treatment plans and services to support that young person. So it really does benefit the outcomes. It increases the outcomes and our successfulness around what we're doing. And all of these things then factor into greater job satisfaction for our adults who are working with young people. To the organization, so just kind of a broader step back, one more step and look at this from a broader perspective. When you have staff and youth who are engaged, who have a trusting relationship, who are building services that are specific to the needs of that young person, then you are basically doing the job that you're supposed to be doing and soliciting better outcomes. You are more successful and more efficient and effective in client services. So what you do, you're able to do well, you're able to do with maximum benefit. And it really can, and that speaks to your outcomes, which you then translate to, you share that with your funders, your key stakeholders, and allows you to then generate more resources. You get a better buy-in, you get more support within the community and within your funders and stakeholders. So it really does kind of increase the, I guess, reputation and of your organization in terms of the work that you're doing. Because of that, people are more trusting, more willing to invest resources, time in your organization. And so it just really allows an organization to be effective and then to leverage the resources that come from being recognized as a effective service provider. It also allows, and I think this is important, it allows an organization to kind of be the recognized leader in terms of being completely inclusive in terms of client services. So you become, not just, and a lot of organizations have a niche for serving a specific population, but when an organization kind of approaches this through cultural competency, it can break you out of that niche. So it's not just one particular population that you're dealing with, but youth in general or youth and families in general. and you become the expert, if you will, in the field around diversity and around servicing all youth and their families. All right. The last kind, I think this might be one of the last ones, but it is important to recognize that there is a difference between being nice and being professional when it comes to cultural sensitivity. A lot of times, cultural sensitivity implies that diversity work is just about being nice to other people. And while having good interpersonal skills is very positive, cultural competency is much more than just being nice. It is a professional skill, which means that it has to be learned, and it enables staff and organizations to serve clients effectively and competently. So beyond just simply treating diverse clients with sensitivity, cultural competency really actively identifies and removes any barriers that prevents clients from accessing and participating in the organization's programs and services. It is essential that we work from a cultural competency framework so that we can make accurate assessments and develop these appropriate plans of care. So it is certainly, you're recognizing, but you're also are taking those challenges that a lot of times our young people face into account when you are planning services, when you are creating the support systems for them, and then recognizing the strengths that they bring to the relationship, that they bring to their own plan for services around this. So it's not just dancing around it, but really kind of recognizing the value that they bring, and then planning for those kind of set obstacles, and utilizing strengths. All right. So keys to recognizing cultural competent programs. We've already talked about diversity, certainly striving for inclusion. It is important that a cultural competent organization take an anti-oppression approach. Generally, this is reflected in their policies around cultural competency, very clearly stating that all people, regardless of race, age, ethnicity, gender, sexual orientation, any type of physical or mental handicap or deficit, that they're all treated the same, and that any type of harassment or discrimination or prejudice is not tolerated at all and will immediately be addressed. And that's kind of that zero tolerance that is very clearly stated, that folks are trained around that they are trained to recognize what harassment might look like and prejudice might look like, so that they can step in and intervene and make sure that that's not happening within their organization. It is helpful to recognize that there are different types of effects. So we talk about the social determinants of health that, excuse me, that many times folks who are coming from these subpopulations, and maybe if we speak about the GLBTQ population here, it might be a little bit more specific, that there are certain life experiences that they will face that maybe not, that will not have to be faced by someone who's not gay, lesbian, bisexual, transgender, or questioning. And that actually will impact our ability to stay healthy and to access the healthcare system. So things like poverty, levels of literacy. We don't often think about that. Linguistic barriers, or if they're homeless, all of these things will impact their ability to access the healthcare system and all of those things that allow us to be more effective. So certainly taking that into account. A culturally competent program aims for equity. Equity means, meeting the person at the individual level and making sure that everyone has access to all of the services that are there. And it is a goal. It is a mindset. It's a way to kind of look at things as something that, as a goal, we constantly have to be cognizant of. It's always in our presence of mind as we're working with all of our clients to make sure that we are treating them in the most culturally competent way possible. We're going to talk about a couple of different subpopulations that we have to be cognizant of in terms of cultural competency, because a lot of times these are not subpopulations that we can kind of it's easy when we talk about cultural competency to talk about race and ethnicity, and sometimes even religion if a person dresses differently, because those we can look at and we can kind of recognize that they may come from a different culture or a different background than we have. The two subpopulations that we're going to talk about a lot of times are not, we can't recognize that just from physical appearance. Yet there are some issues and obstacles that these young people face in these populations. So we're going to start with looking at working with youth who identify as gay, lesbian, bisexual, transgender, or questioning. And a lot of times it's very difficult to nail down statistics around prevalence. So you see a lot of variation in the reports around people who identify as gay, lesbian, bisexual, transgender, those types of things. So 5 to 20% or more will identify as GLBTQ or GBLT for questioning. 1 to 10% are transgender, and 1 in 2,000 newborns, are born with ambiguous genitalia. So, and in psychological terms, that's called intersex, where there has been typically prenatal development. There's been some kind of barrier to normal, if you will, physical development of genitalia. And so when they're born, it's very unclear whether or not they are from external genitalia, male or female. That often then will result in surgical reassignment, and you can surgically, create male or female genitalia. Although the now American Pediatric Association, American Psychological Association standards recommend that parents wait until their children are about 18 months to 2 years, because that's the time in which kids identify as either being male or female. That typically is based upon their chromosomal makeup, so their genetic makeup is being male or female. And then at that time, if the parents want to pursue the surgical options, then that would be the time in which to do so, but allowing the child to self-identify first rather than assigning a gender and then, because it's ambiguous, being wrong. So that's kind of the prevalence. And if we look at a national study around the prejudice and discrimination that these young people face, we'll see that there's an average of 35% of young people, we're talking about under the age of 18, who have who've disclosed being gay, lesbian, bisexual, transgender, and experience rejection by families. And what's interesting is that those numbers are a little bit different depending upon how they are identifying. So females identifying as lesbians, 50% are rejected. It drops to 32% for gay men and 26% for those who identify as bisexual. And so, I think it's important to recognize now this is just one study, but it is a national study that was done. But to kind of recognize that, because a lot of times I think our perception and how media portrays this is that lesbians are more accepted, and it's the gay males who experience more of the family rejection when the numbers simply don't support that. So understanding that. That being said, 75% of youth who are presenting as GLBTQ, intersex, questioning all those things, report some type of discrimination or prejudice. 75%. That's a huge number. And 32% have been targets of physical violence, either to themselves or to their own personal property. And when we look at young people who are actually on the street, who have been forced out of the home, they may be couch surfing, they may, they may be the, typical homeless kid, or, I guess maybe not typical, but the homeless kids who are living on the streets. These numbers just skyrocket. They increase exponentially when we talk about these types of things. All right. So there are specific threats that and challenges for young people who identify as gay, lesbian, bisexual, transgender, or questioning. And these are barriers to, to us being culturally competent. So we have to recognize that these are barriers that these young people are presenting, are facing, and it is our job as a culturally competent organization to help break down those barriers. We know that kids who identify as GLBTQ experience physical and psychological threats and harassment, often in the form of bullying when they're in schools at a much higher percent than kids who don't identify as GLBTQ. Because these young people often are rejected by their family of origins, they experience isolation and they're ostracized at a higher percent as well. And that social support and the lack of social support is really significant in terms of their ability to just, feel psychologically safe and emotionally safe around that. So that has a really big component in terms of their resources and the options that they feel like they have. They are rejected, and oftentimes, we tend to ignore the fact that they are rejected by their religious affiliation and the significance that that has. And so that certainly is an issue that we need to address with our young people. They face name calling, and a lot of times this stuff is internalized in self-hatred. Adolescence, this is typically when in adolescence is typically when a person is really coming to terms with their sexuality, their sexual orientation. Adolescence is a difficult time anyway. And so they may not, especially if they don't have that social support, feel like they have any self-worth. And a lot of the negative messages that they're receiving from their family, from peers, and maybe even from their religious affiliation, can be turned inward. So you see a lot of self-hatred, a lot of low self-worth. They just they haven't come to terms with this, and they don't have the support to do that. All of these things put these young people at higher risk for homelessness. Again, if they're rejected by families, many times kids who are on the street and identify as GLBTQ are on the street because their parents have kicked them out. They have actually been forced out of their home. It also puts them at higher risk for self-harm, including suicide. Suicide is already a risk factor in adolescence. It's the second leading cause of death now in adolescence. I think one of the most recent studies, it actually came in at a higher percent than homicide, which is the highest leading cause of death in adolescence. But they're certainly more at risk, and we see that a lot of times in media and the reports when kids who have identified as LGBTQ have experienced bullying and then committed suicide. They also are at an increased risk for substance abuse. A lot of this is self-medicating. They have unhealthy coping mechanisms and turn to, or they have unhealthy. So they will drink, they will use drugs to kind of numb themselves or to feel differently because they can't get that type of support within their environment. And they're also at higher risk for promiscuity, including human trafficking. And trafficking usually folks who are recruiters for trafficking recognize these vulnerabilities because these young people are on the streets. They're runaway or homeless at higher rates, and the recruiters for trafficking recognize this and will target these young people for trafficking and get them in these very compromising and difficult situations to get out of. So when we look at the areas for a competency-based service to GLBTQ youth, there are 4 different areas that we're going to talk about. We're going to talk about creating conversation or creating intentional invitations. And creating intentional invitations includes conversations that we have with the young people, our attitude, and the environment in which we engage them. The second is triage, assessment and counseling. And so we'll look at some best practices around working with young people who are LGBTQ. Advocacy is the third, again, because we've already identified that this is a population that is somewhat isolated, that has experiences rejection at a higher rate. Then it's important to advocate on their behalf and provide that support. And then the last is referrals. So if we may be working with young people, and we may be the folks that they disclose to, they're having some difficulty with, but we don't have specific services in place. Certainly, then creating a network of support within the community so that we can hook that young person up to this type of support and the help that they need. So we'll go through all of these individually, starting with the intentional invitations. I think language is important because words are positive or negative, and they can be very hurtful, or they can be very empowering, depending upon how we're using them. So really just kind of being aware of the language that we're using, and that the other clients are using, that staff members are using, because they are very, very powerful. It is common among some youth to, if they are disparaging an activity, to say that it's gay, and that is, that's a very, in that term, negative connotation of that word that actually applies to how maybe one person is identifying themselves. So, being aware of those types of things, and then again, going back to that zero policy, that, zero tolerance policy, that is, that's not going to be a way that we're talking. We're not going to use those words. We're not going to use those negative labels around that. Some youth will self-identify, and so when they do, we can use their words in reference. So, whether they're homosexual, gay, they will self-identify, and a lot of times it's just asking them what they prefer, and using their own words. Language does change. It is important to recognize that. It's important that we're comfortable with those words as well. There are, especially I think in certain subpopulations, words that they themselves are able to use and will use, but and it's not derogatory when it is derogatory when someone else outside of that population uses it. So we have to recognize that as well. Again, it's always important to ask. Always important to ask when you don't know something, when you feel uncomfortable when you're unsure about language, about words, about terms. Ask. Typically, you're going to do this on a one-on-one situation for the most, so you want to just be sure that you are being respectful of what is the comfort level of that individual, what they're, and just kind of following their lead. And again, always in programming, you can train your staff, and everyone is great. Everyone is working out of this cultural competency framework and attitude. but you will still have, because you're working with young people, you will still have clients who, and this is true for adults, who are going to not understand, who may not, you know, have the respect because they've never been taught that respect within their own homes and families of origins. So it is important in those cases to always confront name calling and bullying, and communicate the need for respect, regardless of what's going on. Creating intentional invitations also include attitude and willingness, because attitude really is, there's a lot of posters, attitude is everything. And it's important for us to recognize what our own attitudes are. And a lot of these are subconscious. They are things that we have learned in our environment, in our own families, in the group that we're, in our work settings. And they still come into play, even though we may not be completely aware of them. So it is important to kind of keep in mind that if you are a person who is heterosexual, that there is this what's called a heterosexist assumption, which is that is the normal way to do it. And this does come a lot of times from the religion and religious teachings and background, historical assumptions around this, but it is just kind of this assumption that if someone is gay, lesbian, bisexual, intersex, whatever, then there's something wrong, and that's that assumption that there is something wrong when it is just something that's different. So recognizing that, it's funny because I teach a human sexuality class, and when we talk about this, we kind of talk about this in reverse. And so think about asking a person who's heterosexual, well, how did you first know that you were heterosexual? Well, how do your parents feel about you being heterosexual? We ask those questions of GLBTQ youth, but we don't ask those questions, if a person identifies as straight. So, and there's some, some value and some judgment that's inherent in those questions. So just kind of being aware of those. There is, if you think about just within the United States, we are still struggling with the acceptance of a sexual orientation that is different than heterosexuality, and so there is going to be some distrust. There's going to we have to understand that these isms, sexism, racism, all of those are kind of negative kinds of things, and the person in those subpopulations kind of carry that knowledge, carry that expectation that they're going to be treated differently. And so, that will impact trust as they work with us. It is so important to understand our own values and our own biases, because we carry that into our interactions with other people. And most of the time we do that subconsciously. So really, when it comes to things like, especially cultural competence, regardless of what we're talking about, we have to understand our own background and the impact that had on our learning, and the assumptions that we make and the stereotypes that we naturally produce. It's just a cognitive shortcut. We do it all the time. We do it subconsciously. But we really have to think about those things. If we want to be culturally competent when we work with young people, we have to understand our own thinking when it comes to things like race, ethnicity, religion, sexual orientation, and then things like, physical or mental handicaps, literacy levels, socioeconomic status. We have assumptions. We have beliefs about those things, and it has to be important. It is important that we recognize what those beliefs are, so that we don't carry them, or we don't subconsciously carry them into, and we're not aware of the effect that they have on the relationship that we have. When we are dealing with young people, regardless of what the issue is, we have to be aware of how ready they are to interact, to deal with an issue. And we have to be guided by that. We have to be guided by their own readiness and their own, ability or comfort level to deal with a particular issue. This is going to be true in the term of GLBTQ youth, because there is a process for identifying as, it's kind of the coming out process that's, and this is based upon models from psychology about coming out. And where they are in that process is going to impact kind of what they're thinking, their ability to kind of self-reflect or open up to other people. So understanding that, and then being guided by them. There are going to be cases in situations in which you are uncomfortable. And again, I think that's true regardless of what we're dealing with. But in our culture, especially true around sexuality and around sexual orientation. So, there will be times in which you are uncomfortable, and you have to be okay with being uncomfortable as long as you are interacting and doing something that is in the child's best interest. So, and I think it's really easy to equate this situation to, a parent who is talking to their youth, regardless of orientation, about sex. When you have that first, birds and bees conversation, it is uncomfortable, but it is important for parents to do that so that their young people, have the correct knowledge. And so, again, it's kind of the same situation. It may be uncomfortable for us, but it is something that young person needs, and we have to be okay with that. And we also have to recognize, psychological, it's term transference and countertransference, but really what that means is that we are kind of what we bring into the relationship is also past relationships. So if you're in a relationship with a young person, and maybe you are a male staff member, and they are responding to you with a little bit of hostility, or maybe a lot of distrust, and you're not really sure where that's coming from. It may be that they are identifying, you have some similar characteristics, like with a father or with another male adult that's important in their life, and they are, kind of projecting some of those issues onto you as a male staff member. Or if you're female and mom issues, those types of things, that's that transference piece, that you really are, working through an issue with a person based upon some past experiences. And clients do this, but guess what? Adults do this as well. So, and a lot of times they may remind us of another client that we've worked with. They may remind us of a family member, a friend that we had. We're just kind of doing, we're projecting onto them some things that are not about that individual, but, something from our past. And we have to be aware of those as well. And so, again, being aware of it, you can talk through it. And I've had to say this in a clinical setting, you really remind me of, I had, a client who reminded me of my cousin. And there were some emotional responses that came out of that were present for me. And, I said, you remind me of this. And so if I'm responding in a way that you feel is not specific to you, let me know, because I don't want that to get in the way. So you just be open about it and talk about those types of things. All right. So another part of this intentional invitation is the physical environment. So this really is just kind of the atmosphere that is created when a young person comes into your organization for any type of services or programs. Thinking about, is it open? Is it inviting? Whether it's the waiting room, whether it's your own office, a common area, a gym? Is this some place that all youth are going to feel comfortable? And the best way to know that is to have the youth tell you. So you simply ask them and then use their feedback to create this environment that is open, inviting, safe, and warm for all young people. All right. The next component in helping young people with, the challenges faced if they are GLBTQ is this triage, assessment, and counseling. And so when we are triaging, this is a medical term, it's just kind of trying to figure out what's going on. It's really, really important to assess for safety and risk behaviors, because we know that young people who are GLBTQ are isolated. They don't have the support systems. They may be on the street. They may have low self-worth that will not inhibit them from engaging in risk behaviors. We have to understand what's going on. I worked with a young man who he identified as heterosexual, but he was engaged in survival sex to get food and a roof over his head. And that presented some specific health risks for him. We had to talk about what some of those things were. So you have to understand and assess for safety and risk behaviors. What are they doing? Are they self-medicating? Are they using substances? And then the risk to their safety from others. Are they being bullied? Have they been beat up? Or all of those things. We have to also assess this support network, because we again know that they're isolated, they've been rejected. 34% of them have been rejected from family of origin. Then what other support do they have in place? And find that kind of network of caring adults and peers that they can rely on to support not only for things like their physical well-being, housing and food and that kind of thing, but also emotional and psychological well-being. Someone who is fully supportive, who is respectful, who's there for them no matter what. And then once we understand what the barriers are to their safety, if there are risk behaviors, we see what support that they have. I'm really kind of trying to create this environment that is stabilizing for them, so that if they are, they face certain threats or barriers to safety, then we kind of reduce those, and then we open up their opportunities for support and make sure that they're safe and they feel safe. They feel supported by us, so that we can kind of move on, because that safety piece is important. We have to understand that survival instincts typically are going to override most other issues, and we have to stabilize those before we can kind of move on. I think another very, very key piece in this triage, assessment, and counseling is protecting confidentiality. For the most part, if you're a YSB, you have, it's required for accreditation that you have policies and procedures around confidentiality. But just let's take this a step beyond and understand that it also means avoid pathologizing the young person. A person who's identifying as GLBTQ, again, that goes back to that heterosexist assumption that that's something wrong with them, and that's not the case. They may face obstacles, but that's not something that is inherent to their own person. It's something that happens because of the environment and the safety and other people around them. So there's nothing wrong. We have to help build supports around that. We have to strategize with the client around the things that are going to work with them, the things that are going to work for them. Building on their strengths. So this whole kind of strength-based approach around that. And there is the balance that you have to walk in terms of documentation and protecting privacy, especially if there are mental health records. They have to follow the HIPAA guidelines. around that. And so following those guidelines, but you still have to do documentation. You still have to, we're treating them again because this is about reducing disparities in services that are available. So making sure that they're included, but in a way that meets all of those requirements. And I think, again, unless you are doing case management notes, counseling notes, those types of things, it's not going to be as big of an issue. But for an organizational point of view, this is something that needs to be addressed. How do you meet those requirements and do so in a way that is protecting the confidentiality of that young person? Thinking about it in terms of if those records got subpoenaed by the court, then how are those notes kept in a way that still protects confidentiality of that young person? All right. All right. When we are, and I mentioned this before in terms of just kind of their readiness, but again, specific to triage assessment and counseling, the more the counseling kind of component, understanding where they are in the coming out process. One model that is used to look at the coming out process is the case model. It's not the model that I'm most familiar with, but it does kind of mirror a lot of other models around coming out. The idea that the young person may at first experience confusion because they realize that their feelings are not the same thing that other people are expressing. So, if you're in a peer group and your other friends are talking about how pretty a girl is, or those types of things, and those are not your feelings, there's that initial confusion. What we know from most of the research now is this confusion typically is going to happen pre-adolescent. So kids kind of become aware of their sexual feelings, usually around 10-ish or so, but it's certainly pre-adolescence. A lot of times, if you ask a person, they know that their feelings were different beginning around 6, 5, 6, 7, 8. So it's going to vary, but there is some confusion because it's not what the rest of the world is telling them how they should feel. So they're going to, if they feel confused, they're going to start making those comparisons, and kind of, well, what does so and so? We use our peers, we use other people to kind of judge and our own behavior, to figure out what's right, what is the average experience, all of those types of things. And so that comparison is going to come in place. Then they kind of will reach a point in which they, okay, well, I feel a little bit different. So tolerance, which is different than acceptance, is the first step, but then acceptance, then pride, and synthesis. So these are all very much internal. Other theories look at kind of external behaviors, such as, are they self-disclosing? Are they, do they seek out a community? The GLBTQ community, those types of things. Have they told their parents? Are they only best friends? That kind of stuff. But these are all very internal, looking at where they're at, and it's important for us to understand that so that we can meet them where they are in this process. All right. In terms of, again, counseling, a lot of times young people will experience situations that place them at a disadvantage when it comes to development. So kids who have been abused, whether it's physical or sexual abuse, often are just a little bit delayed in terms of development because they have to deal with the trauma, they have to deal with that issue. And so thinking about dealing with that young person in terms of, it's called trauma-informed care, meeting them where they are, looking at, is there any type of abuse? Is there any type of, and not only, personal within the home, so domestic violence, substance abuse by parents. We know that GLBTQ tend to be victims of abuse at higher rates a lot of times because of this unacceptance, that they may come from dysfunctional families. So not only is the family not supportive, but there are some boundary issues, there are some role barrier issues that increase a person's lack of support around that, their lack of knowing how to fit in. Again, I mentioned domestic violence. Trauma puts a young person, whether it's physical or sexual trauma, puts a young person at increased risk of a lot of different risk behaviors, such as unprotected sex, substance abuse, those types of things. So looking at those risk behaviors and this idea of their isolation and the rejection that they've had to deal with, all of which, again, will impact their ability to cope on a day-to-day level, impact their ability to develop, because they are dealing with the traumatic issues. And so while they may come to us as teenagers, we may still be dealing with developmental issues specific to pre-adolescence, because they haven't had the resources to focus on typical development because of the trauma and because of all of the issues that arise out of trauma. So we have to kind of look at that. Oops. Okay. All right. Another specific area in counseling, when we're dealing with GLBTQ, is this idea of coming out with the families. As mentioned before, 34% are rejected by their peers, and a lot of times both the youth and the family deal with this out of a grief model and a loss model. So if the young person has been kicked out of the home, if they are not part of that family anymore, they are going to experience this in terms of a loss, and have a lot of the same responses as a person would if there was a death in the family. So it really is some grief issues and loss issues that we have to recognize as well. And it can be the same for the parents. If the parents, we can bring the parents and the family in to work with this. A lot of times working with the adults within the family to look at what expectations are, if those are realistic expectations, and help adjust those. Many parents work out of fear for their child. If their child identifies as GLBTQ, young person, then they have certain fears. They're going to fears that are sometimes justified as in terms of being more exposed to bullying and those types of things. But sometimes those fears are also unrealistic, and like they can never have a family, and they can never get married, and we're kind of moving in a direction where that's not as much the case anymore. But looking at those types of things, looking at consequences of actions, and then finding that common ground with the young person and the family, so that there can be, the healing can begin, the sense of acceptance can really start to grow around the young person. That young person, a lot of times the only thing that is different is that they, have identified a different sexual orientation, and helping the family recognize that that's still the same person. It doesn't change, the fact that they're intelligent. It doesn't change the fact that they are a loving, caring person. All of those things, just kind of helping the family work with that. Because our goal, if that family can be really supportive, is to kind of reunite them and to work through these issues. So this is going to be a specific area that is going to require a little bit more time, some really, I think, purposeful planning around re-engaging family for our GLBTQ youth if they've been kicked out, and work, this additional process that the family has to work through in order to recreate that support system for the young person. All right. There are also some specific issues to think about in terms of transgendered youth. because transgendered youth is not so much about sexual orientation as it is about identity. And a person who is transgender typically it will identify as so it may be a person who identifies as female in a male body or vice versa. And so a person who is in a male body but identifies as female will be attracted to males, but do not identify themselves as homosexual. They identify themselves as heterosexual because they feel like a female attracted to a male. And so that can kind of get difficult for people to understand, helping the youth understand that, making sure that you as a staff person, the family understands that. I think if there's residential component, then housing is a big issue. Typically shelters are divided by the boys' side and the girls' side. So an organization really has to think about what they would do in a situation where they are housing a transgender youth. Again, there can be developmental delays, usually related to trauma and what's going on. And I think because of the difficulty in understanding, I think a lot of times transgender gets lumped, it gets lumped into GLBTQ, and we understand gay, we understand lesbian, we understand bisexual. There's a lot less understanding around transgender. And so that confusion is not only external, it's also internal. And it's an issue that we have to work with in terms of just general understanding around that. Additional relationship kind of issues, it presents a different problem for a young person, different obstacles, if you will, for a young person, and being kind of aware of that and helping them through those as well. All right. Adjustment counseling, I want to kind of we're going to speed through this a little bit. But adjustment counseling is very, very different than conversion counseling. And I want to make sure that we understand that. So adjustment counseling is about validating the coming out process. It is recognizing that there's going to be this prejudice, that there is some rejection that they are experiencing. Some of that can be internalized. All of that affects the decisions that they make around their behavior, and helping them kind of come to terms with what is realistic, what is in terms of people's reactions, what they want from the world, all of those types, and then helping them find ways to get to those goals, and identifying, potential problems that they may have in terms of relationships, and then ways around all of that kind of stuff. So adjustment counseling is about helping that young person adapt to their environment and relationships in the most successful way possible. That's really no different than the goal of counseling in general is identifying an issue and obstacles that get in the way of successful living, and then helping find healthy ways to cope with those. And so adjustment counseling is applying, it is just that. It is no different, except that we are recognizing those issues and obstacles that are in place that may be specific to sexual orientation, and incorporating problem solving around that. That is different than conversion or reparative therapy. And in fact, conversion and reparative therapy is no longer endorsed by the American Psychological Association. In fact, the American Psychological Association has come out against conversion and reparative therapy. Both of these basically try to change the sexual orientation of a person. There is absolutely no data that shows that this is at all successful. Typically, people will repress their sexuality, and they may then exhibit behaviors that are more consistent with heterosexuality, but the feelings do not change or go away. And because they don't change or go away, and a person is repressing this, it often leads to more trauma and more problems for that person. So Nothing supports conversion or reparative therapy, and in fact points to additional trauma that occurs when a person is engaged in conversion or reparative therapy. And again, I would say the American Psychological Association has now come out against this. And I think in California, they just recently made conversion therapy illegal because they recognize that it is damaging. And the first ethical responsibility of any clinician is to do no harm. So just kind of say that there is that research that shows that this is harmful and certainly not effective. All right, the last part of the effective component of the competencies in a program with dealing with GBLTQ and any youth in general is this effective advocacy. It is different in that we do have to understand what the current policies and laws are around issues of sexual orientation, and then be willing to advocate and speak up on behalf of GBLTQ youth. We have to continually assess our own organizational capacity around cultural competencies, and look for those gaps, look for those blind spots so that we can minimize them and be successful around that. Not only educate ourselves and our staff, but other people around us. That's what advocacy is. It really is educating other people around certain issues, and advocating on behalf of the GBLT youth population, because youth typically do not have a voice, but also on behalf of GBLTQ colleagues as well. So really just kind of understanding what the current policies are, and then being willing to identify gaps and speak out so that we can decrease those gaps. In order to do this effectively, it is important that we are not the only voice. So building a professional network, and in larger communities, there may be a community center that, or maybe a city or county council task force that works specifically on GBLTQ issues in rural small communities. Maybe those additional resources are less likely. You're probably going to find them more in college communities as opposed to non-college communities, just because there are more resources. So understanding what's out there, understanding who you can partner with, who you may need to educate and recruit, and then really begin to build this network of support so that if you are working with a young person who identifies as GBLTQ, and your agency doesn't have the programs or the resources to provide to that young person, you have the ability to refer out. So again, just kind of understanding all of this, being able to build this community of support, being willing to take action. That's really what advocacy is about, is being willing to speak out and request action on behalf of someone else. And so finding a way in which to do that in a way that is acceptable to your organization. You do have to know what your organization's policies are around that. And then you may have to start within your own organization, and create this awareness and the need for action within your own organization before you can speak out within the community. All right. Any questions specific to GLBTQ? And then we're going to spend a little bit of time talking with youth and families who live in generational poverty. All right, no questions. We're going to go ahead and move on. Then, again, just starting with some statistics, understanding that kids under the age of 18, many of them are living in low-income families. more than 72 million children, more than 72 million children under the age of 18 living in poverty, 45% of those in low income, and 22% of those living in what is considered poor families. So this is a large percentage of our youth population. We are talking about kids, and it's a lot of times this is one of those areas that we fail to recognize that there are some specific differences in terms of resources, in terms of learned behavior and attitudes. So I think it's important that, because we are working with kids in poverty and low-income families, that we understand what those differences are and can be aware of those. A lot of this is based upon Ruby Payne's Bridges Out of Poverty. And so her book, she identifies 8 resources that are necessary in order for a person to be successful, to live independently and successfully. And so those include, financial resources, emotional resources, mental, spiritual, and physical resources. Spiritual being kind of believing in divine purpose, physical having, health, being able to be mobile, get around, those types of things. Support systems include family and friends, that you have kind of backup support in times of any crisis or need. So again, not only backup support emotionally, but also could be, financially, if you just absolutely had to, who'd you borrow money from, who could you go live with, who could you, who's there that you can cry on their shoulder. All of those types of things will fall into support systems. Relationships are also a part of that. It's a little bit different because relationships are going to be, for youth, access to adults who are appropriate, nurturing, and are role models, and that they are not engaging in self-destructive behaviors. And again, for everyone, it's knowledge. Another resource is knowledge of the hidden rules. There are a lot of unspoken rules and cues and habits of different groups, specific different socioeconomic groups. And poverty is about other resources. Living in poverty is about not having access to not only just financial resources, but all of these other resources. And in order to move out of generational poverty, we are building the resources in all 8 of these areas so that they can kind of move on and be successful. The resources that we in the services and the programs that we're providing that we can really impact include the mental resources. So I know in many of our programs, we are doing homework help, we are doing tutoring, we are, increasing literacy levels. And so all of those would impact kind of that mental resource. We also are providing additional support in terms of, helping them learn how to navigate the system, if you will, how to fill out applications, how to apply for the resources that are available within a community, how to go to a job interview, how to fill out an application, conduct an interview, keep a job, all of those things. And then a lot of the work that we do in terms of the emotional support that we're providing is based upon kind of role modeling what it looks like to appropriately engage with and interact with other people, to handle frustrations, to kind of deal with adversity and not give up. So a lot of that, excuse me, will come from the relationships and role models, so that we can actually show a young person what it looks like to be successful in all 8 of those areas. Really kind of focusing on the positive interactions, the positive support that we can provide, making sure that we control our own frustrations, and role model what that looks like for them, that we engage appropriately with people, so that they start to see maybe a difference in what and how the world um, can be navigated, as opposed to their traditional family of origin. I think the biggest challenge for, and this is true and stated and kind of emphasized in Ruby Payne's book, but the biggest challenge for getting out of poverty is managing money, and the idea that in poverty, money is spent and not saved. And this comes from a lot of the kind of the hidden rules that we have. It also comes from navigating the system, and in navigating the system, there's this recognition that um, even though we're all speaking the same language, even though we're all speaking English, we do speak it differently depending upon our situation and depending upon our settings. And so she identifies 5 different ways of speaking. Frozen is structured. It's always the same way. It doesn't change. It typically is going to be something that's associated with ceremonies or oaths, things like certain prayers, so the Lord's Prayer or those types of things that are always just kind of static and related to specific, usually events. So you're not going to find those very often. Formal language is standard sentence structure and word choices that are going to be specific to work and to school. So formal really is about thinking purposefully about how you're structuring something, how you're saying something in a way that is understood, that may demonstrate a lot of, I guess, a better understanding of the situation. And when we speak formally, we're really purposeful about the way that we speak. So there's not a lot of casualness about it. Consultative is formal, but it's used in conversation. So while you may be, if you're writing something, if you're developing curriculum, a lesson plan in school, a curriculum for one of your programs, maybe you're doing case notes, a lot of that's going to be formal. Consultative then is formal language, but in conversation as we speak with clients, as we speak with coworkers and colleagues, so that it's not as direct as formal language. You have a little bit more of the personal that's kind of incorporated into the consultative, but it's still kind of the formal structure. That's different than casual. Casual usually is about a 400 to 800 word vocabulary. So it's going to very much depend upon nonverbals. A lot of times when we speak in casual language, when we're talking with friends and family, we don't complete sentences because the other person will kind of pick up on that. And you just have this understanding of casual language that doesn't require, the formal word language, the formal word structure that's necessary. And then intimate language is language between, 2 very close individuals. And interestingly enough, intimate language is also the language of sexual harassment. So it's intimate language that is used in an inappropriate relationship or inappropriately. When we talk about how this applies to folks who come from generational poverty, there is some differences in the language that is used by folks who are minorities and who are poor, because they often will speak in the casual register. And they may be completely unfamiliar or are less familiar with formal language that's used in school and in work settings. And oftentimes, casual is in contradiction with formal language. So that by their lack of understanding, knowledge, use of formal language, it puts them at a disadvantage. And we make assumptions not only based upon physical appearance, but also about language and word usage. And so they may go into a setting, a child who comes from a generational poverty family of origin, may not have had the opportunity to learn those rules around formal language, to learn about formal structure, to learn the vocabulary that goes along with that, and that then creates barriers for them. Another way that it is different for folks who live in generational poverty is this idea of hidden rules. And a lot of this comes out of kind of our belief about certain things, the values that we place on things, and how those are different based upon socioeconomic status. I am going to mostly just focus on, now there is a difference between poverty, middle class, and upper class. I'm going to focus more on the poverty middle class. And then if you have children or you're interested in the upper class, I would refer you to the book. But just because of the majority of folks that we're dealing with, I'm going to focus on poverty and middle class. So when we talk about possessions, typically possessions for people in poverty are other people. It's the relationships that they have. Whereas possessions for middle class folks are things, things that we own, tangible things. And so, just in terms of speaking about possessions, there can be a very distinct difference between those folks who live in generational poverty and middle class, because we don't think in middle class, we think about things when we think about possessions, and folks who live in poverty think about people and their relationships. Money is often, again, one of those things that there's a real distinction in terms of its use, its value, and its purpose. Because money for most folks from the middle class is something that's to be managed, that you budget, that you save. It has its, it is about kind of, I guess maybe moving yourself forward or up, and you use money in order to increase status. Whereas in poverty, money is used and spent. It is, it's not something you manage. If you have it, you use it, you spend it, and most of the time you use or you spend it to maintain relationships. So, money for middle class is about status and kind of broader base, but money for folks who come from generational poverty, a lot of times is about using it to maintain those relationships. One of the biggest differences that I see in terms of a youth setting, and I will say that mine's been specific to my time at Youth Services Bureau in Bloomington. And when I was at Columbus, but I think, on a broader base, you see this difference in the education and the value that we placed on education. For middle class people, education is something that we achieve, that we use, and that we seek out in order to be successful, to earn money so that we can manage money and move our status up. But the purpose of education is really about how we move ourselves forward in our life's goals and the things that we want for ourselves and for our families. And so education is valued because it can move us into different opportunities, provide us with different resources. Education and folks who live in generational poverty is valued, but it's valued in a very abstract way. So it's almost as if because they don't have that, there may be a lack of understanding in how to use education to reach goals. There is less of almost a motivation to seek out education, because they see the value as different. It's valued, but it's not purposeful. for folks who in middle class, it is very purposeful. And I have seen in youth work a lot of the workers who come from middle class who see education as having this purpose, try to, I don't know, not enforce, but try to place that kind of value on kids who come and families from generational poverty, there's a mismatch there. So understanding that around that. And then, of course, language. I've already talked about language, using language formally, using language to increase status, to get us where we want to be, to negotiate for the things that we want. Whereas poverty for folks in generational poverty really is about, the casual language that is about survival. It's about just kind of the day-to-day kind of thing. Yeah. Those who live in poverty do not understand the hidden rules of the middle class. And for those who live in middle class and not understanding the hidden rules of those who live in generational poverty, we tend to be judgmental. We can be judgmental about that. So when we understand the differences, it allows us to be less judgmental and to see the opportunities for teaching the rules, the hidden rules, and to provide the supports that are necessary to help promote upward mobility. And again, I think there's a little bit of a value statement in the idea that we should be moving folks, out of poverty. I mean, certainly they have more resources, they can be more successful, but we have to kind of get out of this idea that something, again, is wrong with them. It is about resources. It's about learning and opportunities to learn, and how do we provide them with those opportunities. Now, poverty can be different. It can be situational or it can be generational. So when we talk about situational, usually it is a situational poverty is a person who has suddenly experienced a loss of resources. Maybe they've lost their job. Maybe they have increased costs because of medical issues that have placed them in a financial situation where they don't have the ability to maintain housing or pay bills or those types of things. And folks who are experiencing situational poverty typically are going to refuse any type of help. They will not access, the help through Department of Children's Services. They won't access TANF. They won't access Medicaid or food stamps or any of those types of things because they see it as being temporary. And so they can lean on those additional resources that they have, whether it's financial, mental, emotional. The people in situational poverty do tend to have more resources. They know how to navigate the systems to move themselves out of that situational poverty situation. People who grow up in generational poverty do not have those additional resources. They typically are not, they don't see the ability to access those resources. They don't know how to navigate the systems to access them. And a lot of times may feel like society owes them a living. And so they will access things like TANF and food stamps because that is what is owed to them, as opposed to learning how to provide those resources on their own from other sources. There's also some differences in terms of their ability to manage their own situation. Because a lot of times, especially if the families existed in poverty for more than 2 generations, there can be a sense of fatalism. There can be this sense of learned helplessness, so that they have tried to get out. They have failed in those situations. So maybe children have seen this with their parents or their grandparents, and in fact been penalized. And so they learn not to help and just, to live and to live with and deal in the situation that they currently have. And I think about situations with, say single moms who try to get a job, who go out and they'll find a job. They go through the whole, how to get a job, how to maintain that, all of those successful ways to manage money. And they've put all this time, they put all of this effort in. They go out, they find a job, they get a job, they start earn money to earn money, and then what they learn is they can't earn enough that will pay for the babysitter. Maybe they don't get help with child care. Maybe when they do start to earn more, their food stamps are cut so that they might be able to pay rent with what they are earning, but they can't pay rent and buy food, but now they're making too much money to get on. So it can be kind of this vicious cycle. And, there are some circumstances in which the system actually enhances that feeling of learned helplessness. So understanding that, and then being able through that understanding to put other supports in place and make sure that as we try to introduce these resources and help them find them on their own, that we're not penalizing them at the same time. There's also a difference in terms of gender and the gender roles that are different for folks who live in generational poverty. Typically, the female moms are the center of a family tree, but that mother may have multiple relationships with other male members. Males are going to typically be in and out of relationships, and the alliance that they have is to the family in which they reside. So there can be this favoritism with the family that they're currently living with. So you may see a father in generational poverty who will commit his resources and time to the children in the home that he's living with, but not to the children that he fathered in a different relationship. So again, you kind of see a little bit of a difference in terms of how that is going to interact relationships and the support systems that we can build for our kids in generational poverty. So what can we do? Ruby Payne takes a stance that education is key to getting out of generational poverty because it provides emotional support, it provides relationships, it provides skills, and it provides role models. So we can meet the young people where they are in their reality, go back to that individualized kind of relationship that we have in their reality so that we understand their circumstances, we understand their barriers, their resources, and that will allow us to be more effective in building support systems for them. We can ourselves provide that emotional resource and the support that they're going to need. And I think that's one of that maintaining that relationship, a consistent relationship, and that emotional support is an easier thing for us to do. When we understand the differences in language, when we understand the differences in the hidden rules, then we have the opportunity to teach those differences in language, to teach formal language that will help them be successful in school, that will help them be successful in work settings, to help them navigate the system and the hidden rules that are in place so that they can be more successful. And I think it's important that we have to understand that trading off relationships for achievement for time is going to be necessary, so that they may cut ties, and they may feel the need to cut ties with folks who may still be in generational poverty, and focus on achievement, focus on education, to make that shift. And that's going to be difficult. And it may be something that we will have to help provide additional support around. Obviously, we can provide appropriate role models and support around all of this as well. I think one, kind of maybe last thing to look at when it comes to how we deal with kids from generational poverty is understanding that they are going to interact with people and adults in maybe a different way based upon the interactions that they've witnessed with their adults and with adults in their lives and um, the role models that they've had to that point. So we have to kind of look at kind of discipline specific to youth at poverties, understanding that effective discipline is going to be structured, it's going to provide choices, and it really is about allowing people to govern themselves. It's not about us controlling behavior, it is about providing opportunities and skills so that they can govern their own behavior. It is different from punishment because it is about teaching rather than control. So there are certain behaviors that are related to poverty, and understanding these behaviors will allow us then to provide corresponding interventions. So many times children who live in generational poverty will laugh when they are disciplined. And a lot of times this is understanding, this is about saving face. And kind of not being, their pride is not being damaged. So if we understand this and provide them with 2 or 3 other behaviors that would be appropriate, so we want them to cease the behavior, and we give them choices about what to do, then it's not about they're not allowed, it's not about our control, and then we're not letting them do something. They can choose to do something different, and that then allows them to save face. They may also argue very loudly because, remember, the language in poverty is very casual, it's very participatory. This is a culture which generally has distrust of authority and distrust in the system because it seems unfair to them. And so, understanding that means that it's very important that we don't argue with the young person. We actually, if we can, create a dialogue that will allow the young person to kind of write through the situation, write questions about a situation. They're going to argue about it. Why do I have to do this? Why is it this rule? Why can't I? Have them write those down so it's not verbal, it's written. Then we can sit down and go over those, the answers to those with them, and do all of this with respect, so that we are modeling respect for that young person. They're being heard. We are treating them with respect, and then we'll allow them to kind of learn that behavior. We are certainly answering those questions. They feel heard, and it will minimize arguing. We often will get an angry response when, in a discipline situation, and typically that response is based upon fear. It could be fear of some type of physical, violence. It could be fear of, again, losing face, of feeling maybe unvalued or disrespected. So again, what we can do is just keep very calm, respond in just a very quiet, slow paced kind of volume and cadence. And then when they have cooled down, processing this with them so that they can understand what our perspective was, understand that there were different ways in which they could have interpreted that maybe if they were feeling angry because they thought that we were putting them down, that's not the case. So, kind of provide them with disconfirming evidence about some of the assumptions that they're making about that, and then other ways in which they could have responded. So again, it's about a learning behavior around that. And so that they learn different ways to behave. They may also respond with inappropriate or vulgar comments. Again, because of this reliance on the casual language, they may not know how to respond more appropriately. So if we can ask them to say things differently, maybe provide them again with examples of ways in which to do that, that really kind of talks about broadening. It allows them to broaden that language. It allows them to learn that formal language, if you will, to respond to those situations. And because, again, folks who come from generational poverty, and the adults in the family often are very disrespectful of authority. They may have a lot of mistrust. This will translate into disrespect from the youth. And so, if we explain the value of respect, if we model the value of respect, oftentimes we will have to give them the language. We will have to show them the behavior that is respectful, and then allow them to practice that. It is the part that is, again, a learning process. Remember, these are kids who are coming from situations in which their opportunities to learn different ways of behave have often been limited. So what we're doing when we use discipline is allowing those teaching moments, and having more than one set of behaviors giving them more than one set of behaviors to choose from in dealing with a situation, and some that are appropriate for home and some that are appropriate in a work and a school setting so that they can be successful in that setting. All right. So what you see is a list of the resources that I've used. The very last one is the Framework for Understanding Poverty. It's that Ruby Payne Bridges Out of Poverty framework that we often use in youth services. So just kind of understand that. If you have any questions, I don't have my contact information. You can always reach me at Indiana Youth Services. It's R. Donaldson at indysb.org, indysb.org. I'm happy to answer any of that. This has been recorded. It will be available on the Indiana Youth Services website and our YouTube channel. And with that, I will thank you very much for the time that you have spent and ask, are there any questions? And you can type those in or unmute your phone. No questions? All right. Well, thank you again for being on. Josh, I appreciate it. I'm sorry that you're leaving.
Thanks, Robin.
All right. Well, if you have any questions, you know how to find me. Thanks so
Yep.
much.
Thanks.
All right. Bye-bye.